Welcome to this week's podcast on aromatherapy, complementary therapies for people with dementia. Aromatherapy is the use of aromatic plants or essential oils to promote well-being through scent. It is not a replacement for medical treatment and should only be used if it appears to bring some pleasure or calm to the person being treated. Aromatherapy scents are released by warming oils in oil burners, adding it to baths, dripping the scent onto pillows and tissues, or massaging infusions of the oil into the skin with creams. You need to be aware that undiluted essential oils are very strong and they can irritate the skin, so please read the label to make sure the oil is suitable for your purpose. Aromatherapy has been used for centuries to relieve stress and to promote better sleep. Lavender oil dripped sparingly onto a pillow or into a bath before bedtime is said to aid sleep. Eucalyptus oil is a very strong smelling oil useful for clearing the sinuses when suffering from a cold. And lemon melissa balm applied as a lotion can have a calming effect. Some small studies have been undertaken into aromatherapy and dementia, and they've started to show some encouraging results, but obviously more research still needs to be done. The main findings of these studies were into the effects of lavender oil, dripped onto a pillow or applied through massage in the form of a cream, and lemon melissa balm rubbed onto the skin. Both oils were found to increase the length of time a person with dementia sleeps for and decrease signs of agitation such as wandering and excessive movement. So, some practical tips on aromatherapy and dementia. A personalised approach for the person with dementia is vital. Consider whether they are comfortable with being touched if you are considering a massage. A massage with essential oils may also not be suitable if the person has eczema, psoriasis, allergies, cuts, any broken skin at all, or bruises or delicate skin. Please remember that scent is a powerful and evocative sense. Try giving the person with dementia a tissue with a drop or two of the essential oil to see how they react to the smell before embarking on any further aromatherapy. Try talking with the person and their family to find out whether aromatherapy is something they've used in the past. Always practice aromatherapy in a well-ventilated area. Best results may come from consistent use. So if the person with dementia seems to enjoy the treatment, consider practicing this every day. Do not experiment with different oils together. Choose the best one linked to the outcome you hope for and stick with that. And remember to discontinue your practice immediately if a rash appears on the skin. Things to just be aware of. Now, as mentioned before, aromatherapy oils are very potent and they may cause a headache, which a person with dementia might not be able to communicate to you, hence a well-ventilated area. The smell may trigger memories for the person which they might find confusing or distressing. So if this appears to happen, then that scent is triggering unwanted memories. Some oils have a stimulating effect, for example, thyme oil. Stimulation could possibly lead to increased agitation, so be aware of that. Using oils with a calming effect are best practiced in the evening shortly before bed. Thank you very much for listening to this podcast. If you want further information on aromatherapy, you would be well placed to speak to a complementary therapist. I've left my contact number here if you have any questions and want to talk to me about anything that I've discussed today. There's also the Admiral Nurse helpline number here, which is Monday to Friday 9 till 9, Saturday and Sunday 9 till 5. And for anybody listening, either the carer or the person living with dementia who has done any time whatsoever in any of the services, you would be entitled to a Royal British Legion Admiral Nurse, and the number's at the end of this page.